As we have injuries to the hip, small or major, as we have muscle problems that occur, certain muscles start to work more than others and we start to develop these problems that can occur in the hip. One would be an IT band problem. And so your IT band is a structure, the tendon that runs down the outside of your leg. It has a number of muscles in the outside of your hip that attach to it. But again, as we're moving that leg, let's just say with walking, as we're moving that leg and taking that step, the ball needs to rotate in the socket. But if the muscles that attach to the IT band are either too strong or too tight or too weak, then what starts to happen is the ball starts to shift around in the socket. It starts to create this pinching and this pressure. That can cause pain in my hip, but it also puts a lot of extra workload on the IT band. So then the IT band starts to tighten up, trying to pull the hip into the socket more, which is counterintuitive to what that tendon and that muscle are really supposed to do. That IT band should be acting as a shock absorber so that every time my foot hits the ground, this doesn't happen. Remember, the job of a muscle is to pull the joint open. But if the tendon now all of a sudden has to contract and tighten itself to close the joint, well then every step I take is going to allow there to be more compression in the hip and potentially lead to some hip problems and or definitely an IT band tendonitis. As that problem progresses, not only do I start to have the pain in the IT band, but I'll start to get some pain in the joint because again, that tendon is pulling that joint closer together. Now I'm getting some pinching, I'm getting some rubbing of the bones, leading to some other problems down the road. How can PT help? Well, there's really two factors. One is, if you're not having any hip problems currently, now's the best time of all to get your hip checked out. Because every time you move in and out of a chair, up and down stairs, walk, etc., every time you're standing, you're relying on your hip joints to work perfectly. If you're not having problems, well, obviously they're working well. But you, just like your car, you get it tuned up, you get the oil changed, etc., you want to make sure that certain things aren't beginning to happen in and around your hips. Mostly that glute weakness, that hip weakness that allows certain problems to get started. Now on the other side, if you're having hip problems or you've had hip problems in the past, now's the time for an expert physical therapist at Loudon Sports Therapy Center to do a full evaluation of your hip. Find out what's going on with the mobility. Where are things flexible? How is your joint moving? Does it stay open when it's supposed to stay open? Is the integrity of the joint being protected? What's going on with the labrum? What's going on with the muscles? And what needs to be done for your hip versus what the internet tells you is good for everybody's hip? And what needs to be done with your hip to get that problem taken care of?